I believe that at the end of the day, we must have a serious, quality public plan. Because I believe short of that, we will not be able to keep the private plans honest. There's got to be that serious, public, quality plan out there that folks who end up in that know that they get the kind of care that they need and when they need it. And again, it keeps the private sector plans honest by having that serious plan there. And I want to just hear you comment on this, that conversation continue to happen. And I hope at the end of the day, that is what we'll end up with, at least that covers all, and a plan that covers, everyone is covered in some form or another.
I think that's the overall intent. One of the challenges we face right now is the Senate is really ahead of us in the House by a couple of weeks. And they're wrestling with this very issue. If you have a public plan, how it's going to be shaped, what it's going to look like. Do we really have one in the end? Or is it one that can be on par and compete and not be an unlevel playing field? And I think that's going to be the real challenge at the end of the day. How do you do that and be on a level playing field and keep the public and the private work? I think there's some people who know a lot more about this than I do who are working on it. The Senate's going to be ahead of it. I think the House will probably start to work on it within the next 2 weeks. I can't tell you definitively today the answer is yes or no, but I can tell you that's one that's still in the mix.